Hey folks, I think we'll get started. It is noon, as usual. This will be a live cast on Facebook Live.
Folks,
My
we'll get
apologies.
started. It is noon, as usual. This will be.
I always forget that Facebook Live it's never muted, and so yeah. Okay. Well, anyways, that's muted. Like I said, this will be on Facebook Live and as well as recorded and uploaded to my YouTube channel later on. So if you can't make it at noon, this will always be on Facebook Live, as well as on my YouTube channel after the broadcast. So there will be records of it so that you can watch it later on if you'd like to. If you have questions, please throw them up in the chat or raise your hand. If you're in the Zoom session, if you are on Facebook Live, you're always welcome to throw up a comment on the Facebook Live feed, and I'll try to get to those. So lots to cover today. So let's get started. As usual, we'll go over some general numbers around the world, just take a really quick view of what's going on in the world, as well as what's going on nationally and locally. And then we'll go into some really interesting news and some commentary that I have about the school year, Delta, and what the COVID endgame is going to look like. So we'll get started. All right. All right. So some good news globally. It looks like numbers are going down. It looks like it has kind of peaked and numbers are starting to go down. And it looks like it's fairly, the plateau's been happening for the last couple of weeks. So looks like the numbers are actually going down. Now with Delta, because of how unpredictable Delta has been, I don't want to really draw too many conclusions, at least for a few weeks, till I see a more consistent trend. What we've learned about Delta is that there's dramatic shifts. You got sudden spikes and then dramatic declines and then sudden spikes again. I think UK numbers are very much evidence of how unpredictable Delta is. So I'm not quite sure what's going on here, but overall it's good news. So let's look globally where the hotspots are. Right now, hotspots remain kind of the same. The US is probably the biggest hotspot, but we have some issues in Mongolia. And Mongolia is a country that's really, really struggled with COVID. They have not been able to get control of their local outbreak. Malaysia, the same. They've really struggled of late. Georgia, the UK numbers are starting to go back up again after a decline. Really unpredictable numbers out of the UK. Eastern European numbers, particularly the Balkans, are starting to go up again, which is bad news given how much Eastern Europe has suffered through the first few waves of the global pandemic. So if you look at details, these are just counts. You can see the US leads the way right now. South America is actually continuing to decline. So that's good news. South American numbers are looking much better. And the trend has continued now for several weeks. So that's really good news for a continent that's been really hammered hard throughout the pandemic, hasn't really gotten a break. India numbers are better, but they're still pretty high. So they're still struggling with Delta, not to the degree they were a few months ago, but they're still struggling. South Africa is struggling a bit. Africa in general, though, again, it's hard to read too much into African numbers, just given the lack of testing and lack of data infrastructure. But it seems like, Delta definitely affected Africa. There was a huge wave of hospitalizations and deaths in certain countries, for example, Botswana, Namibia, South Africa, and a few other countries. But it seems like those numbers are now going down, at least in sub-Saharan Africa. Northern Africa, there's some disturbing trends there. So by continent, you can see that Asian numbers are going down. Indonesian numbers, which were driving the Asian numbers, are better as of late. So the numbers are going down a bit. Still a bit of a mystery as to what's going on in China. China is not reporting numbers. I hear anecdotal stories about shutdowns in certain cities because of Delta. Perhaps those have worked. It's hard to say. The Chinese have not been forthcoming with data, so it's hard to say what's going on. I know Japan is continuing to struggle. Those Olympics were just a really bad idea because their numbers are continuing to go up. North America, of course, is doing quite poorly. You can see the numbers there. We are almost, from a count standpoint, we're almost up with Asia. We're about maybe 50,000 less than Asia, 40,000 less than Asia, but Asia is a far more populous continent, so we are not doing well. European numbers look like they've kind of plateaued, but at a fairly high level. As Western Europe numbers go down, Eastern Europe numbers go up. So it's just kind of a whack-a-mole there. Looks like the Delta is kind of starting to shift towards Eastern Europe. As I mentioned, the Balkans, the numbers in the Balkans are getting really, really high, disturbingly high. South American numbers, like I mentioned before, continue to do well. Africa, according to the numbers, is doing okay. But again, it's hard to tell. And Australia, New Zealand, Australia is struggling a bit. They've kind of lost control of the Delta outbreak in Sydney. So we'll talk about that in a bit. From a sheer count standpoint, we are by far number one, 166,000 cases a day. India's second, pretty far down at 36, then the UK. Iran is continuing to struggle as well. Brazil is doing a little bit less well than the rest of South America, but overall, Brazilian numbers are down. You can see Japan is up there now in the top 10. Never thought that would happen, but yeah, they're seeing 20,000 cases. And then you can see the rest of the numbers here. Southeast Asia continues to struggle as well, I should mention. Even though things are a little bit better, Thailand and Vietnam are really struggling. And Indonesia, luckily, the numbers are down. So that's kind of driven overall Asian numbers. You can see Israel up there too, the top 20. And we'll talk about Israel quite a bit. As far as a per capita standpoint, Cuba, Malaysia, and Indonesia and Mongolia lead the way. And you can see hotspots popping up in Israel, Eastern Europe, Georgia. Georgia's continuing to struggle. Botswana numbers aren't great. From a per capita standpoint, North America is by far the worst. We're about 340, 350 per million per day. Those are not great numbers. European numbers, like I said, is plateaued. South American numbers continue to do well. Asian numbers are kind of plateaued and going down a bit. You can see Australia and New Zealand, from a per capita standpoint, is now worse than Africa. Partially driven by Australia, partially driven by Papua New Guinea too. There's a surge in Papua New Guinea. Of course, that is part of Oceania. This is shocking. Israel is now number one per capita, 1,000 per million. That is an extraordinarily high level, especially given Israel and its vaccination status. Now, I think the vaccination status, we've lauded Israel for their vaccination campaign. They vaccinated their population very quickly, actually. They were the first, early on, right after the vaccines were developed, you could see the numbers going up. However, I think that was a bit of an illusion because they reached about 60% in April, May, and they have not budged since. They vaccinated pretty much everyone that will get vaccinated, and then they've really not vaccinated too many more people. Now, Israel is a younger population, comparatively speaking, so there are a big segment of their population is not eligible for vaccination, children under 12, of course. But that doesn't explain the gap. It seems that there is a lot of vaccine hesitancy in Israel. So if you consider that 65, 66%, it was high, but is no longer a very high number. So we'll talk about that in a little bit. So that's kind of the shocking news here, that Israel is now #1 in the world in terms of cases, daily cases per million. Dominica, of course, is a very small Caribbean country. There's several small Caribbean countries that have been struggling with Delta. You can see them here: St. Lucia, Cuba, Grenada, St. Kitts. So yeah, the Bahamas. So there's been several. In small island nations, surges tend to happen very quickly. And are oftentimes hard to control, especially in some of these islands where tourism is such an important economic driver. So a lot of these cases are driven by tourism. So it's kind of one of those things where, in order to survive, they have to open up the country, but they're also exposing themselves to Delta. And that's what's probably happening in a lot of these smaller Caribbean and as well as Pacific Islander countries. You can see that the US is in the top 10, so we're not doing well at all. I mentioned Georgia. I mentioned Eastern Europe, especially the Balkans are struggling. Montenegro's up there, Kosovo's up there, and Macedonia. Let's see, Serbia. Yep. So yeah, Albania. So you're seeing that shift from Western Europe to Eastern Europe. In terms of changes, the increases in the US the increases have declined. We're still increases, but the increases have declined. You can see Australia, Papua New Guinea seeing it surge. That is Chad. Chad is seeing some high numbers, which is concerning given that Chad is one of the poorest countries in the world. Let's see. You can see that shift. Norway seeing a surge, but also this kind of slow shift from Western Europe into Eastern Europe, is particularly the Balkans, where you're seeing numbers increase. In terms of death, we again lead the way in deaths from COVID. So these are counts. You can see Asian numbers are down, but they still lead the world. Basically, the remnants of the surge in Indonesia. So there's still a high number of deaths in Indonesia, Iran as well. So that's why Asian numbers are high, but they are going down. So that's good news. North American numbers continue to go up, and that's a really steep curve. So North America, particularly the US, we're struggling, and Canada's starting to struggle as well. European numbers are starting to plateau. South American numbers continue to go down, and you can see the African numbers and Australia and New Zealand. Like I said, we lead the way, about 1,400 deaths a day now. Russia is second, Mexico third. Brazil still has a high death rate, even though numbers are better. They still have a high number of deaths. You can see Indonesia's numbers are down now. They were up at the top for a while until we took over. And then you can see the rest of the countries. Again, I want to point out Southeast Asia still continues to struggle, and they're seeing a high number of deaths. Again, it's sad seeing that, given how well they were doing earlier on in the pandemic, controlling controlling the numbers in their country. But again, traditional public health tools, masking, social distancing, restrictions, they're short-term limited tools meant to keep numbers down until vaccines are ready. Unfortunately, vaccine distribution, of course, global vaccine distribution has been a mess, and Vietnam, well, most countries in Southeast Asia still have a shortage of vaccines. They just have the demand, they just don't have the supply. Then here's the map of deaths per million. You can see that Eastern Europe is starting to pop up here: Mexico, Georgia, Russia, Malaysia. North America now leads the way in deaths per capita as well. So deaths per million, we are at about 4. South America is next with about half the death rate that we have. Then Europe, Asia, Africa, and Oceania. So we're not doing well in North America. The rest of the world seems to be doing a bit better. But again, the Delta variant is so unpredictable. It's hard to really what I've noticed in just, looking at these numbers for a long time now, with the original variant and Alpha, these trends tended to be more gradual. You didn't see so many dramatic changes in numbers. With Delta, though, given how transmissible it is and how it takes such advantage of mass gatherings, super spreader events, it's much harder to predict now what direction the numbers are going to go. Here are the numbers in terms of deaths per million. Bahamas is number one. So again, the Caribbean is struggling. We don't really talk much about that just because these are very, low islands with very low populations. But tourism's in full swing in a lot of these islands, and rightly, and I understand why, because these economies are so dependent on tourism, but it's also driving a lot of COVID. And we'll talk about Hawaii when we talk about the US, but Hawaiian numbers are high, not because of the local population, but because of tourism. So I really encourage folks to think twice before traveling right now. I don't think this is a great time to travel. Given the surge in Delta in a lot of these countries. So you can see Georgia continues to struggle, Macedonia, Kosovo, so a lot of the Balkan countries, and you can see US is now in the top 25 as well. Not a great place to be. And then these are the countries where you're seeing increases in deaths. You can see Europe, Eastern Europe, particularly Norway as well, Australia and Japan. And Japan, again, this is that lagging indicator. Japan's numbers are not looking great. They're still continuing to go up. It might bring down their government pretty soon, because a lot of criticism about the Olympics and how this surge was handled. And it was handled quite poorly. It really was. Like I said, I mean, I know the Olympics mean a lot to a lot of people, but it was really not a great idea. So as I mentioned last week, I'm going to go through these numbers a little bit quicker and focus a little bit more on the news. In terms of just overall observations about numbers, it looks like global numbers are plateaued, maybe dipping a little bit. Again, it's hard to really hang your hat on that given how unpredictable Delta is. And I didn't show you any data to demonstrate this, but Delta is by far the predominant variant in the world. So it's really Delta right now. Delta's running the show. And given how transmissible it is highly unpredictable. So it's really hard to, it changes a lot quicker, a lot more dramatically than the other variants. Okay, so it's hard to kind of predict anything in the future, where the numbers are going to go. So the hotspots again remain North America, Europe, parts of Asia. It looks like African numbers are okay. Again, hard to tell. And South America, the good news is South America continues, their numbers are continuing to go down. So that's great news for a continent that has struggled so much through this pandemic. In terms of vaccinations, we are now above 5 billion doses, which equates to about a big, huge jump in people vaccinated, because Chinese data is coming in like in just spurts, and those lines there indicate when we got access to Chinese data. You can see how much the numbers change. So given the data out of China, we are now at over 3 billion folks vaccinated, which is good news. Still not nearly enough. And these numbers are very, very low in certain areas, particularly sub-Saharan Africa. But we are still, continuing on vaccinating folks. These are the countries, and I mentioned Israel. It doesn't look so great at 68% when you compare some of these other countries where, the UAE, Portugal, they're above 80%. Iceland, they're all above 80% of their total population vaccinated. Granted, these are older populations, so there are fewer children. And in particular, UAE and Iceland, these are smaller countries with smaller, less populous countries. So vaccine campaigns are much more effective there. But still, we're talking about over 80% compared to Israel, which is at at 68%, and they've been stuck there for a while. They have not really budged. Once they reached about 65%, you saw their numbers just decline dramatically. The rate declined dramatically. So if you think about how transmissible Delta is, 68% isn't a whole lot. And yes, it does subject them to severe surges like we're seeing. So we'll talk about that more because I want to really focus on 3 countries later on, the US, UK, and Israel, and try to see if we can get some, get some ideas on whether the UK and Israel experience can predict what's going to happen in the US. Jamie, you asked a question about COVID tests for variants. So no, like for example, if you take the Abbott Binax test on campus, it's an antigen test. The test itself just determines whether you have COVID or not. It does not test for variant. The variant tests are much more involved. And they're done at a state lab level. So the state lab will take a sample, and they don't test all the they don't genotype all of the samples, only a fraction of them, only a sample of them, just because there's so many and because this process is so involved and expensive. So we don't actually type all of them, just a sample of them. But it's it's a good sample, so it's pretty predictive of of how much Delta there is, and it really is just about all Delta. Delta is just nothing right now can outcompete Delta, because if you think about just by evolution and viruses and viral and evolutionary competition, the biggest variable, the biggest advantage is the ability to replicate faster, and Delta has that in droves. I mean, that's what's going to drive viral evolution, not how deadly it is, not how much whether it puts people in the hospital or not. It's simply how quickly it can reproduce. Thanks, Chris. Yeah. So Chris's comment that, the cheapest, quickest way to detect a variant is a specific qPCR probe, and that is much more involved than the typical diagnostic test. So yeah, we can't type all of them. Now, there are countries that are typing every single positive. For example, Denmark is doing that. But given our sheer numbers in the US, it's just almost impossible to do. But I guarantee it's almost all Delta. I'll bet money on it. And I'll show you the data. Sorry, I'm just checking my Facebook feed. I'll show you the data later when we talk about Utah numbers. Right. All right. So anyways, back to this. So you can see checking my Facebook feed. I'll show you the data later when we talk about Utah numbers. Right. Sorry, that was the echo from my Facebook. This is not a professionally produced video. Just FYI, it's just me and my laptop. So just, you have to bear with me. I don't have a producer or a director or a sound person. I just have me. Occasionally Fred, but he's not very helpful. All right. So back to our chart. So you can see that there are a lot of countries. Again, US is not in here because we have fallen out of the top 25 a long time ago. We're at about, we'll see our numbers in a bit. So you can see a lot of countries. Even the UK is down pretty far down that list. China is all of a sudden at 74%. China, and because they just gave us that data, we realized that the Chinese have been vaccinated, mostly with their domestic vaccines. They've been vaccinating furiously. So that's good. Actually, Canada has excellent vaccination numbers, and now 67% of their population has 2 doses. Remember, with Delta, that 2 doses is incredibly important. 1 dose doesn't protect much at all against Delta. 2 doses, however, are very protective. So that 2-dose metric is much more important than the single dose. The single dose is important in that we can assume, hopefully, that most of the folks who get that first dose will eventually get a second dose and have full protection. I think that is now the case. I think fewer and fewer people are just getting 1 dose. So that's good news. But yeah, you can see that there are some countries with really, really high vaccination rates. Again, some of them are very small, like Singapore, Iceland, the Seychelles, but there's some large countries here as well. Spain, Portugal, Uruguay, Denmark, Chile, China. So I mean, we're making inroads, but you also notice that most of these countries on this list, not all, but most of these countries tend to be the wealthiest countries. There are very few countries from sub-Saharan Africa. I take that back. No countries from sub-Saharan Africa on this list, and very few countries in Asia. So, but there are some exceptions. For example, Mongolia has done a phenomenal job of vaccinating their population, but they still are having some serious surges, but they are vaccinating very well. Bhutan has been for a long time a model of public health, and the numbers show, because their numbers have been really, really phenomenal. And they are a poor Himalayan country, and they're able to do this. So, okay. Now, I promised I want to focus on Israel, the US, and the UK. Now, it was quite shocking when I saw Israeli numbers this week and that they were #1 in the world per capita. And given all of the kudos that they received for their vaccination campaign, and for the longest time, they were the most vaccinated country in the world, but that didn't last very long. And they were stuck right around the 65 to 68%, which again, in a world filled with Delta, isn't much. We're thinking that we have to get 90+% of the population vaccinated before Delta can be controlled. I'm not even talking about herd immunity at this point, because I don't think that's even a thing anymore. But just to control and keep transmission levels at a reasonable level, I think we're looking at 90% plus, given the R0 right now at 4, 5 maybe. Some predict some actually predict it's higher. So we're going to need to vaccinate a lot more. So 68% is just not enough to control something as transmissible as Delta, and the Israeli numbers show that. The US and the UK are right about the same place in terms of per capita number of cases, but it looks like the UK, like, this is why I say Delta is so unpredictable. You see this huge spike, and then all of a sudden it just dramatically goes down, and then it starts to go up again. And the UK, and again, it just shows how sensitive Delta is, and how Delta takes advantage of mass gatherings, seasonality. We think that this big spike in Delta was due to Eurocup. In the UK, of course, Brits love soccer, or football as they call it. And the fact that the English team went really high up in Eurocup, that brought a lot of people together, not just to the stadiums, but to pubs, because that's where English folks go to watch games. And if you've ever been to an English pub, they're not exactly socially distanced. And it's hard to wear a mask if you're, downing a pint. So huge spikes. And what's interesting about that UK spike was it seemed like it was mostly in young men, AKA folks who are most likely to go to the pub or to soccer games or to have big parties around soccer games. Also, Scotland saw a surge as well during this time, but the Scottish team got knocked out early. Coincidentally, or not coincidentally, Scottish surge stopped earlier than the English surge. So there's a lot of data there to show that perhaps the English surge was due to Eurocup. And then when that was over, numbers went down. But remember, Prime Minister Johnson also touted Freedom Day right when that decline started. And then everybody basically removed all restrictions. And then boom, that decline stopped and it started to go up again. Really, really unpredictable. So is that what's happening? Now, Israel, similar. There were days in June, there were several days in June where Israel had 0 cases. And we honestly thought, hey, the vaccine's working. Maybe they reached herd immunity. But then boom, Delta hit. And they did not, they probably didn't, because they only vaccinated less than 70% of the population. And given how Delta can be transmitted among those vaccinated, you saw numbers skyrocket. Right when, again, this coincided with the Israeli government opening up. We saw Netanyahu being removed as prime minister. A new prime minister came in. He was very much opposed to restrictions, opened up the economy right when Delta was surging, and this is what happens. So what does that say about the US? Well, right now, the big unknown, my big fear is schools. Yeah, fall is a time when there's a lot of population movement, a lot of contact, a lot of potential transmissions, particularly in schools where mask mandates have highly politicized. There's another fight at a school board meeting in Florida. Utah school superintendents have flat out said, we are not going to debate this. We are not going to impose this. It is because of the fear of violence. We're school boards. People get elected to school boards to talk about schools and education policy, not to get beat up by angry parents. So they basically flat out said, we don't want this authority. So in that scenario, we're looking at kids going to school, little to no masks, kids under 12 not vaccinated. Yeah, it's really nerve-wracking. That combined with all these natural disasters, wildfires, hurricane season is in full swing. There's a lot of potential there. That, and of course, everybody's traveling. This weekend, everybody's traveling. People are going to Florida, people are going to Sturgis, people are gathering as if the pandemic's over. So, yeah. Now, the other thing about these numbers, my guess is that infection numbers are far higher. I mean, magnitudes higher than what are being reported, particularly in the US. We're just not testing enough. And given the asymptomatic nature, I think there's a lot more infections. So asymptomatic or very mild symptomatic cases are going unreported because people aren't being tested. And also breakthrough infections as well. I think there's a lot more breakthrough infections than we are detecting because we're not testing people who are vaccinated in general. And that's the only way you're going to get breakthrough infections. I mean infections, meaning not breakthrough disease, not symptomatic disease, but infections. So these are folks who are asymptomatic, who have the potential to shed virus, but don't show symptoms or show such mild symptoms, they're not going out and getting tested. I think that number is far higher than is being reported, which is good news, bad news. Good news is maybe we are getting to a point where we have enough population immunity where things slow down. Bad news is these are folks that are spreading the disease to people who are vulnerable. So anyways, and this kind of shows, you look at the testing, Israel and the UK are testing far more than the US. I mean, far more. Israel's testing more than 3 times as many people. The UK, more than 2 times as many people. They're detecting more disease. Now, Israel has essentially a vaccine passport where you have to have proof of either vaccination, prior infection, or a negative test within the last 3 days to enter a lot of their, basically to enter anything in Israel. So if you want to go to a restaurant or a bar or a show, sporting event, you have to show this. So there's a lot more testing in Israel because of that. We just aren't testing enough. So anyways, In terms of hospitalizations, this to me is a much more important metric than infection. Okay. And I think we need to, again, redefine vaccine efficacy in terms of disease, not infection. The COVID vaccines do not, it isn't sterilizing immunity. It does not stop the viruses from entering the cells and replicating. It does do that to a lesser degree, but it doesn't guarantee it like some other vaccines, like the HPV vaccine or the smallpox vaccine. So infections are going to occur, but it is still highly protective. And I have some news to show you that show this. It is still highly protective against disease. So to me, hospitalizations are what we should be really focusing on, not infections. Hospitalizations. And you can see that in Israel and the UK, hospitalizations are still fairly low per million people. So you can see the UK numbers are not very high compared to their peak back in January when they saw some horrific numbers. So this is prior to vaccinations. You're seeing far lower hospitalizations in the UK. And that's thanks to their high vaccination rate. Israel, not quite as high. Israel is still, I mean, it's not quite as low as the UK, but it's still lower than before. And in the US, we're slightly lower, but not as low, mainly because so much of our population is still unvaccinated and ending up in the hospitals. I think it's important to emphasize that Israel is reporting a lot of breakthrough infections and breakthrough hospitalizations. However, that's just statistics. The more uninfected, more vaccinated people there are in a population, the more breakthrough infections are going to occur. That is just math. That is not an indication of vaccine failure. It is an indication that there's just more people who are vaccinated. Therefore, there's going to be more breakthrough infections. I think that's really important to emphasize. So places like Israel and the UK, where reports of all these breakthrough infections, well, that's because there's a lot more vaccinated folks than unvaccinated folks. Okay. In deaths, it's even more pronounced. The UK deaths, you look at back in January, there were about 18 per million. Deaths have gone up, but it's right around 1 to 2 deaths per million. So a far cry from their pre-vaccine days. Vaccines work. Again, US numbers are higher because we just have fewer people who are vaccinated. And I know that senior populations tend to have higher vaccination rates, but we still have a significant proportion of the senior population unvaccinated, and therefore very high risk for death. And that's probably what you're seeing here, particularly in places like Louisiana, Alabama, Mississippi. So, and here's the difference. I mean, we're at barely 50% of our population vaccinated. UK and Israel are over 60%. So yeah, we have a lot more vulnerable people than Israel or the UK. Okay, so what can we read into from that data? And this is, by the way, just case fatality. You can see that Israel and the UK are right around less than 0.5%. The US is right around 1%. So more than 2 times the case fatality of Israel and the UK. And that's probably because, again, the higher vaccination rates in Israel and the UK compared to the US. So what can we take away from this in terms of trying to predict what's going to happen in the US? Like I said, Delta is really unpredictable. And the US, as we've seen, is a huge country and with varying attitudes and responses to COVID. So what happens in Massachusetts is going to be very different than what happens in Texas or Louisiana, which is very different than what happens in Washington or what happens in Idaho. It's just going to be it's going to vary quite a bit. because of vaccination, differences in vaccinations, different attitudes towards non-pharmaceutical interventions, particularly masking, differences in state responses. It's hard to predict. I have some friends in Massachusetts asking about sending their kids to school and how worried they should be. And I said, they should be worried. And I'll tell you why. I want to share the study with you later on, but not nearly as worried as a parent in Florida or Louisiana or Idaho because of the different attitudes towards masking, different approaches that local and state governments are taking, and higher levels of community vaccination. So it's just going to vary depending on where you're at. So yeah, if you have a school kid in Idaho, I'd be, quite honestly, I'd be a little nervous. Chances are, one kid infected can basically infect an entire school where there's no mask mandate and none of the kids are vaccinated. But in Massachusetts or Vermont or New York, where everybody's wearing masks, where state governments are mandating all staff be vaccinated, the risk of that is much, much lower. Yeah, I mean, Deja, I think that's true. UK and Israel do have very robust healthcare data systems, but really, ultimately, they can only report what they test, and those countries test far more than the US. So those numbers are, I think, far more accurate and reflective of their true pandemic than US numbers. I think US numbers are really, really underestimated right now. I mean, to a fairly significant degree. I mean, if you just look at the test rates, yeah, ours is just not very high at all. About 4 per 1,000. It's not, per day. It's not much at all. And we're hearing of serious issues, shortages in tests, shortages in infrastructure, huge lines to get tested. So we're running into some structural issues as well in terms of testing in the US. Yeah. In fact, I wanted to order some Binax antigen tests on Amazon, and I just discovered that they won't be delivered till November. So that's a problem, actually. That's a real problem. Okay. Let's talk about US numbers. A lot of people see this and see, oh, hey, maybe we're peaking. I don't know. I really don't. It looks like it, but there's some problems with the data. Number one, a lot of states their data reporting isn't as robust. Like, for example, Florida's reporting COVID numbers once a week. Nebraska, counties are not allowed to report numbers, only the state. So a lot of states are playing political games. Texas as well, because Texas, I don't have much to say about Texas beyond that right now, because otherwise I'll just rant. But yeah, so yeah, the data is really unreliable, and a lot of political games are being played with the data. Remember, the CDC can only report data that's reported by the states. We have 50 different, well, actually, Puerto Rico and the territories and Washington, D.C. also have their own independent public health departments. We have 50 different public health departments, 50 different infrastructures. And the CDC's data is only as good as those state health departments. So even though we see this plateau, I'm not going to read too much into this. I don't think we're peaking. I think we might see an even bigger surge in the next few weeks now that school has really started. Remember, schools in the Northeast and the Midwest start later. They may not have started yet. A lot of schools start after Labor Day. Utah's a little unique in that we start really, really sticking early. So by region, oh, hey, Louisiana is not Louisiana. By the way, Louisiana and Mississippi numbers are going to be probably very unreliable for the next several weeks. What? Because of Hurricane Ida. Huge swaths of Louisiana and Mississippi have no power, and they're just trying to scramble, get people clean water and power. So, COVID is not going to be quite as prioritized. So just keep that in mind. South Carolina has taken over as the number one state in terms of cases per capita. You can see how steep that is. Again, the Delta tour of the South continues. Yeah. Here are the hotspots. You can see very clearly the Southeast, and what's concerning is starting to spread into the Midwest, the lower Midwest, Ohio, Indiana, West Virginia. And it's kind of starting to show similar patterns to last year when it started in the South and spread into the North and Northeast and the upper Midwest. It's starting to show that. I don't know if that'll do that this time because, of course, the key difference now is vaccinations. The Northeast has very high vaccination rates. Same with the upper Midwest. So it may not show the same patterns as last year. We'll see. We will probably see a surge in the Northeast, but not to the degree that we're seeing in the South. Again, the big difference being vaccinations. But you can see it's starting to spread into Ohio and Indiana, Illinois. Out west, Oregon and Washington are showing some high numbers as well. Same with Northern California, parts of Nevada. Wyoming looks like it's just bursting, and it is. Not coincidentally, Wyoming has one of the lowest vaccination rates in the country. And with Delta, being rural is not protecting you. I mean, look at the South. So Wyoming's become a hotspot. South Dakota's becoming a huge hotspot. We're seeing triple-digit % increases in South Dakota, not coincidentally, right after Sturgis. And we all know Governor Noem she's not particularly concerned about COVID. So she did not learn from previous years, Sturgis, and welcomed motorcyclists again to Sturgis this year. And it's becoming another super spreader event. I mentioned some states aren't reporting county data. Well, Nebraska. That does not mean Nebraska has no cases. Far from it. It's just they're not reporting it. So that's that's extremely frustrating to epidemiologists. We need data. When you don't get data, we have no idea what's going on. So the political games continue. In terms of by state, Florida and Texas lead the way, but California is catching up at 14,000 cases a day. Then Georgia, Tennessee, North Carolina, South Carolina. I mentioned Ohio, New York is up there in terms of sheer numbers. So this is just counts. A better measure, of course, is per capita. And you can see South Carolina is first, then Tennessee. So it's starting to spread up from the deep South into the South, into Kentucky, Tennessee, Alabama, Mississippi is still high, Florida as well. Wyoming is up there, of course. Like I mentioned, Wyoming is seeing some really high numbers. Not in terms of numbers because I believe it's the least populous state in the lower 48. Yeah, I'm pretty sure that's the case. Yeah, but they're seeing from a per capita standpoint, it's not good. Guam is an interesting case. So Guam is, of course, a U.S. territory in the Pacific. They are seeing really high numbers. They have opened themselves completely up to tourism, and a very specific kind of tourism. Just reading this today, they are openly advertising in Asia for vaccine tourism. So they have Pfizer, Moderna, all the good vaccines, and they're trying to attract wealthy Taiwanese, wealthy Japanese, wealthy Koreans, wealthy Filipinos, Southeast Asians to come to Guam to get vaccinated. The problem is that also increases numbers because you have all these travelers, most of them who are unvaccinated, most of them who are carrying Delta. And that's probably what's happening in Guam right now. Yeah, I just read that. It was interesting. Well, that's maybe if they have excess doses, why not? But at the same time, it does open you up to Delta. And once Delta establishes itself on an island like this, it's really hard to control, surprisingly. I mean, the Seychelles and Maldives, and as well as the Caribbean, are demonstrating this. So anyways, the other end of the spectrum, by the way, you look at the vaccination rates of all the states with really high numbers, and yeah, there's clear correlation. Guam is a little bit of an exception, 62%. It's hard to say if those numbers in Guam are due to native folks in Guam or from the tourists. So a lot of them probably are tourists because they're getting tested at the airport, coming up positive. That could be the case. Guam actually has one of the higher vaccination levels in U.S. territories. You see, Florida is kind of an outlier because they have 50%, 53% of their population vaccinated, but those folks are concentrated in urban areas. And if you look at Florida, the real hotspots in the urban area, most of the folks in urban areas like Miami-Dade County are vaccinated. So, those are what's driving up those vaccination numbers in Florida. But the rural areas have very low vaccination, particularly the Panhandle in areas of Central Florida. And that's not coincidentally where the hotspots are, right? But yeah, and then Hawaii is also an exception because, again, I think that's largely driven by tourists coming into Hawaii. Again, I don't know if they separate out those numbers to differentiate folks who live in Hawaii versus visitors who are required to get tested to get into Hawaii. So I know the governor of Hawaii has asked folks to stay out of Hawaii, to stop going on vacation there. And that's a pretty big deal given how much Hawaii is dependent on tourism. I had a talk with some of my students who are on the women's soccer team in Westminster. They had a trip to Hawaii to play soccer, which was, wow, that's nice. But I also talked to them about how this is the situation you're going into. Luckily, there were 3 native Hawaiians on the team, and they talked to their teammates and say, hey, this is what you need to do when you're there. We need to be extra careful, extra respectful. So anyways, but yeah, actually, Oregon and Washington are showing up there. I think part of that is due to, of course, Washington and Oregon are largely rural, especially the western part of their states, and they're adjacent to Idaho, which is of course very rural and have very low vaccination rates. That's probably what's explaining Washington and Oregon. Now, the other end of the spectrum, you can see states with very, very high vaccination rates. Michigan is a bit of an anomaly there. For those folks unfamiliar with Michigan, most of Michigan is very rural, very conservative. You have the southeast, that's Michigan. I went to school in Michigan. This is how you describe Michigan. You put up your hand with the mitten and you point on the mitten where you're from. That's what you do in Michigan. So most folks live right here, the Detroit area, Metro Detroit area, in the southern part. The northern part is very rural, very conservative. Remember, Michigan militia is a thing. The governor was, there was a plot to kidnap her and so on. So it's an interesting state, kind of similar to Washington and Oregon that way. So that's probably why the vaccination numbers are so low there. But yeah, most of these states have very high levels of vaccination. They tend to be in the Northeast. So yeah, we'll see if that lasts. It's hard to say. I mean, we're seeing countries like the UK and Israel see massive surges, and they have vaccination rates very similar to those countries, to Israel. These states have vaccination rates very similar to those countries, and they still saw a surge. So yeah, there's no guarantee that that level of vaccination is no guarantee that they will not see a surge, and they very well may. Probably not to the same degree. Oops, sorry. went too far, not to the same degree as the South. So in terms of changes, you can see Guam has a significant change, but South Dakota, I mentioned South Dakota again because they just didn't learn. They had a huge super spreader event, and this is the result of it. Just about every state has seen an increase, but the increase is much more pronounced in states with lower vaccination levels. In terms of hospitalizations, Florida leads away in numbers as well as per capita. Their hospitals are just getting hammered. But again, mostly the South. And then you see North Dakota popping up there too. So the Dakotas are starting to surge. Deaths, Florida, in terms of numbers as well as per capita. Florida's really, really, really struggling. It really is. But yet you still see fights at school board meetings because of masking, differences in opinion about masking and vaccine mandates. I believe Governor DeSantis signed a bill saying that private companies will be fined $5,000 for every instance they ask for a proof of vaccination to go into their business. So, yeah. Okay. So the patterns in the US are pretty much the same. There's a change in what state is surging the most. And this week's it's South Carolina. Next week it could be Kentucky. But otherwise, most of the numbers are focused in the South. That's where you're seeing the biggest surges. Wyoming is a bit of an exception. Meanwhile, the Northeast and Upper Midwest, they are seeing increases, but not to the degree that you're seeing in the South. In the West, it's a little bit patchier. Utah numbers are reasonable. Wyoming numbers are really bad. Idaho numbers are starting to go up. Same with Washington, Oregon, California as well. So the wild card, of course, is natural disasters. So again, what is hurricane season going to do? When you mix in Category 4 hurricanes with a global pandemic, it's not a good mix. Same thing with wildfires in the West, with COVID, evacuation centers. It's hard to say. Okay. As far as vaccination in the US, so we're about a week plus out of the announcement that the FDA has formally approved the Pfizer vaccine. Moderna formal approval is probably going to be coming in the next few weeks. We're still waiting for EUA for Pfizer for under 12. There were rumors that we may see that maybe by the end of September, which would be really good news. Now, will that actually equate to children being vaccinated? That's the big question. But there is some good news for 12 to 15-year-olds, and I'll share that in a second. So about 206 million dose people, which equates to about 53% of the entire US population fully vaccinated. Far cry from the 80 plus that we're seeing in some countries. But we're slowly making progress. 62% with one dose. And again, the hope is that if all those folks with just one dose will go get their second dose. I'm hoping. Okay. So that's where we're at. Break it down by age. 65 and up we have the best vaccinated rates in the 65 and up group. But again, fully vaccinated, there's at least 18% of the 65 and up still extremely vulnerable to Delta. And these are the folks who are much more likely to end up in the hospital or die from this. So that's a concern. 18 and above, it's decent, about 75% with one dose. Again, the hope is that every one of those folks will get that second dose. 12 and up, the numbers are actually getting better. And so that's the good news. 12 and up, 73%. And I have those numbers broken down a little bit more later on. This is less optimistic. I was hoping to see a bit more of a spike after the announcement that Pfizer was approved. We saw a little bit of an increase, but it's been increasing a little bit for a long time. I don't think we're seeing an effect of that announcement. Maybe it's too early. Maybe it'll go up later. But right now, we're still stuck below 1 million doses per day. So I would have hoped to see a little bit more of a spike. We're not seeing that. So again, I think we're being optimistic that this would sway people. It doesn't look like it swayed a lot of people. But again, maybe it's too early. So in terms of vaccination, yeah, Northeast leads the way. Parts of Washington and Oregon, particularly the western urban parts. Colorado, again, tends to be focused around the Front Range. Utah focused around the Wasatch Front. So definitely an urban-rural split, with some exceptions. For example, Arizona and New Mexico, you see rural areas with high vaccination, but that's thanks to Indian Health Services. And some of for example, the Navajo Nation really being proactive about vaccine campaigns. But in general, you look at the South in particular, rural areas tend to have much lower rates of vaccination than urban areas. And you can see that in Florida as well. The Panhandle area and parts of central Florida have very low vaccination rates. Meanwhile, Miami-Dade County, areas around Orlando, have very high vaccination rates. So a pretty standard pattern that we're seeing. And this is by state. Again, the dramatic difference. I mean, what's sad is how far down West Virginia is on this list. I remember when I started doing this, I was lauding West Virginia for having such high vaccination rates and being really creative in getting vaccines out. Yeah, they have the lowest percentage of vaccinated in the country now. Then Wyoming is now worse than Mississippi. It's not a great place to be. Idaho is right there, North Dakota, Alabama, Tennessee. So Idaho, Wyoming concern me, really, really concern me, given just that folks there are just not getting vaccinated at all. It's a really, really big concern. The flip side is Hawaii, 70%, basically 88% of the 18 to 64 vaccinated, and over 99% of their 65 and older. So great numbers out of Hawaii. Again, a lot of their surge that you're seeing is due to the tourists coming in. They're not necessarily the native Hawaiians, but the folks who live in Hawaii are also, they are susceptible to breakthrough infections because of visitors. So that's something to consider. Massachusetts, Puerto Rico, Connecticut, Vermont. So again, Northeast, New Mexico is up there as well, California, Washington. So yeah. What's just shocking is the sheer difference, 48% of West Virginia in the 18 to 64 to 88%. So, 40% difference between West Virginia and Hawaii. So this is why I say, I mean, in the US, it's really, really hard to predict what's going to happen as a country as a whole, because we're not really one country. We are just a collection of different attitudes and vaccination rates against COVID. So it's, it's hard to predict what's going to happen as a country as a whole. It might be easier to kind of predict what's going to happen in specific regions. But even then, that's really, really unpredictable, given what COVID's been doing in Israel and in the UK. Okay. Talk about Utah, and then I want to focus on the news. And I got a lot of news. So Utah isn't seeing the dramatic spikes that some other states have seen. We're seeing a much more gradual increase. I mean, but we are increasing. We're now up to about 1,500 a day. I hate being wrong. I hate being right, but I predicted this and it's happening. But it's happening. It's just slower. And in some ways, I think that's detrimental because people just get used to it. And they're not as alarmed anymore. They get, oh, it's over 1,000, you get used to it. Oh, it's 1,500, you get used to it. You almost want a dramatic increase just to get people, just kind of kick people in the butt. But at the same time, that would just really, really hammer our hospitals, and they're getting hammered right now. So we are continuing to go up, and you can see that it's really the rurals. If you really want to, focus on this, it's really the rural areas, not necessarily the Wasatch Front. The exception to that is, of course, Utah County, because Utah County is going to Utah County. Am I going to miss Utah County after I move out of Utah County? You all know the answer to that. Because yeah, I live in Draper, but in Utah County, still, at least I don't have to deal with that anymore. All right, so look at the hospitalizations though. We're almost up to the peak that we saw over the winter. So even though we've seen gradual increases, hospitalizations are starting to spike. Deaths are starting to go up too. And you probably heard the report, 2 teenagers recently died of COVID. No pre-existing conditions, unvaccinated. Yeah, get your kids vaccinated. Okay, so by county, of course, the most populous counties, the Wasatch Front counties have the highest numbers. But from a per capita standpoint, Duchesne County is getting hammered right now, 130 per 100,000. Then Daggett County, Sevier County, Emery County, Carbon County, Tooele County, Millard County, Sanpete County. I know those of you who are not from Utah are thinking, wow, those are some funny names for counties. Yes, they are. Particularly Tooele County. Yeah. I'm used to funny places with funny pronunciations because I'm from Massachusetts and we all say Worcester, right? So anyways, what's the good news here is that if you look at the Wasatch County, Wasatch Front counties, for example, Salt Lake, it's fairly low down this list. Same with Davis County. Again, the exception is Utah County because we have really low vaccination rates. In terms of, changes, changes, you're seeing huge spikes in, again, a lot of rural counties, Uinta County, Sevier County, Carbon County, Rich County, Duchesne County, and again, not coincidentally, they have some of the lowest vaccination rates. A bit of a concern seeing, well, no, Grand County is further down, so that's good news. Of course, Grand County is where Moab is. I'm a little bit concerned about some of the southern Utah counties, particularly later on in the fall, because that's peak tourist season. When things cool down there, a lot of folks up here will head down there. Will that actually result in further spikes? We'll see in Grant County. Grant County, of course, had some really high numbers early in the spring, again, driven by tourism from the rest of Utah. But right now they're doing okay. Hospitalizations, again, the Wasatch Front counties aren't doing terribly if you look at just the numbers, or, but look at the rates here. Washington County has the highest, and then Kane County, Iron County. So, yeah, again, these are also counties with very low vaccination rates. So what you would expect. As far as deaths per capita, again, we have such low death numbers in US. It's in Utah, it's really hard to follow any trends because low number of deaths means statistically trends become really, really unstable. Our tests, positivity test, which is the one I like to use, it's about 10% still. We have increased the number of tests. I think a lot of that's driven by return to school. But that's really good news. That means we're catching more students. If you've noticed, Utah is now reporting not just number of daily cases, but also how many of those cases are in school children. So that's reflective of the testing that a lot of schools are doing on their kids. That's really good. That's really good news that we're tracking that. Bad news is, of course, we're getting a lot of infections among kids. Again, most of those kids, the vast majority of them will be fine. However, there is that risk still. Hospitalizations, again, like I mentioned, they have increased and they're getting younger because, senior folks have become vaccinated. And deaths have also increased. Yes, mortality from COVID has never been a huge problem in Utah because it is a healthier population, lower rates of comorbidities, but it's still increasing. And again, it's starting to profile younger, because that's the population that is not vaccinating. In terms of vaccination in Utah, we're making slow progress. All Utahns, we're now at about almost 50%. Almost half the population of Utah is fully vaccinated. It's something. 12 and up, we're about 70% with at least one dose and 61% fully vaccinated. So that's better news, actually. It seems like the 12 to 15-year-old population is getting vaccinated quicker. Might be because of schools opening up. This is less encouraging. You're not seeing much of a spike in, you're not seeing much of an increase in vaccinations. There was a little bit of a slight increase in August, but it's going back down. We'll, try to again follow long-term trends, see if that's actually increased. You break down Utah by age group. You can see the 12 to 15 group. Actually, that's been increasing quite a bit. So almost 50% of the 12 to 15 age group now has at least one dose. And again, the hope is that those folks will get fully vaccinated. As it is, 36% are fully vaccinated. Those aren't bad numbers. They really aren't. Compared nationally. And because that population is so much bigger in Utah than in other states, that's really going to be an important population to look at in terms of vaccination rates. 16 plus is about 72% with one dose, 63.5% fully vaccinated. And you can see the rest. The 65 plus vaccination rates, again, only 84% are fully vaccinated. That leaves 16% at very high risk for hospitalizations and death. So again, good news, that light blue line at the bottom is a 12 to 18. You see the slope of that is increasing. That means the rate of vaccination in that age group has increased quite a bit. That's really good news, okay, especially since these are kids going to school. So the 12 to 15, so those are the middle school and high school kids. Again, high risk of transmission in those situations. Oh, I had a comment. Breakthroughs. Okay, well, I'll try to, Preen. Yeah, I'll try to get to that. I think a lot of the news that we have is related to it. So, oh, yeah. So again, this is breakthrough infection. So you can see the relative risks. 4.7 times more likely if you're unvaccinated to be test positive. Again, my metrics are the last two, 5.3 and 5.8 times. And that is those who are vaccinated or those who are unvaccinated are 5.3 times more likely to be hospitalized and almost 6 times more likely to die. I think those are the important metrics. So those are the breakthroughs. This is the breakthrough data in Utah. And again, Utah has done a great job of tracking this, much better than a lot of other states. But I also have some national numbers I want to share with you that actually shows even better news in terms of vaccinations and hospitalizations. So you can see the relative risk there. And you can see on the graph, the breakthrough. So the top is unvaccinated, the rate of unvaccinated, and the green is vaccinated. You can see a vast difference there. Of course, numbers among the among vaccinated breakthrough infections will increase. As long as there's virus circulating in the unvaccinated, the risk of breakthrough infections will increase. And as we increase the number of people who are vaccinated, that number will increase even more. And that's just math. So we need to just get used to that. Also, breakthrough infection is not the primary. To me, that is not a number that is reflective of the efficacy of these vaccines. The vaccine, the one we should be measuring is how many breakthroughs end up in the hospital, how many breakthroughs end up dying. That's what the vaccines are supposed to do, particularly these vaccines. Do I wish there was a vaccine that prevented infection? Yes, we don't have that. It may not be possible to develop a vaccine like that for a virus like SARS-CoV-2. That's the other consideration. Sterilizing immunity is not always possible. It just depends on the nature of the virus, nature of the infection. But we do have vaccines that are incredibly effective against hospitalizations and death. And that's what we should be focusing on. So let's go over the news. The first thing I want to talk about is the study out of Marin County, California. This was an outbreak investigation at a school. A lot of observations, and this got some play in the media, but I think not as much as it should, because it's really quite illuminating in terms of how transmissible Delta is and the importance of universal masking. So this was a school, believe they saw kids mostly under the age of 12, so not eligible to be vaccinated. They did have a vaccine mandate for staff. However, 2 teachers were not vaccinated, including the one that was at the index case. This teacher started to show symptoms, but thought it was allergies, went to school to teach. Now the classrooms were fully masked, and by all indication, mask protocols and mask hygiene was very good in the school. Most of the kids were very diligent about wearing masks. Same with the teacher. Classrooms were ventilated. They were 6 feet, they were socially distanced at 6 feet, which, by the way, for Delta is kind of pointless. That standard might have worked if it was droplet transmission with the original variant, but with Delta, 6 feet might as well be 6 inches because it's fully airborne. But they did it, okay? And there was ventilation, windows were open, door was left ajar, there was a HEPA filter in the front. So all precautions were taken, except the unvaccinated teacher who was symptomatic, shedding virus, decided to re-allow to the class while taking the mask off. And this is the result. So this is a great map of the classroom. Here's the teacher's desk where that teacher was sitting while reading aloud with the mask off to the rest of the class. You can see windows on either side open, doors open, air filter. Oops. Lots of good ventilation, 6 feet apart, but 12 out of 24 of the students ended up catching COVID from the index case, which is the teacher. It's a 50% attack rate. That's extraordinarily high. That's the kind of attack rate you see with measles or chickenpox and other very highly transmissible airborne diseases. Also notice, in the first row, the attack rate is 80%. 4 out of the 5 I take that back. 100% attack rate. They were all infected. Oops. Yeah, they were all infected. So everyone in the first row was positive. Second row, 3 out of 5, 60% attack rate. Or actually 4 out of 5, 80%, because that other person was not tested. Third row, only 1 out of 5. Fourth row, 1 out of 4. Fifth row, 2 out of 4. So definitely a pattern there. Closer you are to the teacher, more likely to be infected. Again, all the kids were masked. And again, it's hard to say how good the masks were, how well they were wearing. I mean, were they worn properly, et cetera, et cetera. We do know the teacher took off the mask to read aloud. This is the result. Now, again, it just indicates how transmissible Delta is. Incredibly transmissible. 50% attack rate in the classroom. This is an indoor setting with good ventilation, socially distanced, yet it still happened. The other observation, masking has to be universal. I mean, if all the kids were masked, and by all indications they were, one unmasked infected person shedding virus can infect half the masked folks. So masking has to be universal to really work. Therefore, this BS around, we strongly encourage masks, but it's your personal choice, is just that. It's BS. It's not going to work. You've got to mandate masks for everyone. That's what really closes that loop. That's what puts that double layer. It's much more important for a person who's shedding virus to wear a mask than an uninfected person to wear a mask. But they work with each other to prevent infection. The other thing I want to mention is that we don't know what this, I mean, you might say, well, masks don't work because these kids were wearing a mask, they still got infected. That is a false conclusion, because without masks, we don't know if all the kids would have been infected or more kids would have been infected without the mask. So you can't make that comparison. anyways, yeah, really well done study. Now, what ended up happening is other kids in other classes, there were some parties, some sleepovers, they were infected. Some parents and siblings were infected. But the takeaway here is that the community spread wasn't nearly as bad as we thought it would be. And I think that is indication that in Marin County, community vaccination rates are really high. So that I think that blunted the outbreak from spreading to the larger community. So that's really good news. So community levels of vaccination can help blunt these very localized outbreaks. Okay, so that's why I say in places like Massachusetts, the Northeast, or in any areas with high levels of vaccination, yes, you may get huge outbreaks in schools because these kids are largely unvaccinated, particularly in schools where vaccine mandates are not being used. But it will probably not spread as much to the wider community because of high vaccination rates within those communities. What about areas with low vaccination rates? Well, all bets are off there. So another study on masks. This one just came out. This is a preprint, so this is not published yet. A lot of people, a lot of so-called researchers on YouTube, on Google and YouTube, say, well, if it's not a clinical trial, we're not going to accept it. It's not valid. I've had people argue this with me. I welcome it, actually. I want to try to pick intellectual fights with people and not tell them I'm an epidemiologist. I don't know why. I just feel like being a dick nowadays because I'm just frustrated. I know, not very professional, but hey. So this one is a clinical trial done in Bangladesh. So this is what we call a quasi-experimental study. It wasn't a completely randomized trial. They randomized villages. So in half the villages, and it's tens of thousands of people in these villages, and thousands of villages. Half the villages, they had an intervention to increase mask use. A third of them increased cloth mask use. A third of them increased surgical mask use, and a third of them were the control. What they found, and then they monitored mask usage and as well as seroprevalence of COVID after their interventions. What they found was, not a hugely pronounced difference, but definitely a difference between those villages with the cloth mask mandates and those with that were the controls. So you can see the seroprevalence was significantly lower in the villages with the intervention than the ones in control. So surgical masks were the best, then cloth masks, and then you can see the comparison difference. So really the surgical mask was the big difference, the statistically significant difference. But if you put all the masked villages together, it was definitely a statistically significant difference in COVID seroprevalence in those villages. So this is, I think, the first clinical or experimental study, because technically it's not a clinical trial, randomized study. It is the first experimental studies that show the effectiveness of masks. They work. Is it as pronounced as I'd like to see it? No, but this was an intervention study. So there's no guarantee people are going to abide by the mask, but just, encouraging people to wear a mask worked. And you can see symptomatic disease is even more pronounced, right? And by age group, it looks like it worked. It was most effective in the older age groups, which makes sense because they're the ones most likely to get symptomatic disease. In the younger age groups, not as much of a difference. Okay, so this to me says how important it is to implement masks as a community. So yes, it doesn't make as much of a difference in younger folks, but those folks wearing masks keep the most vulnerable in those villages safer. So that to me is the takeaway from this. Not that, in young people it doesn't make a difference. No, again, we can't think of masks as an individual, or vaccines for that matter, as an individual intervention, as a personal risk reduction strategy. We should be thinking of it as a community reduction. This idea that it is personal decisions and it makes a personal difference, we need to get away from that. Okay, so that was an interesting study. Now I want to get into a few other studies showing, okay, let's talk about breakthroughs. This one is a massive one. Again, preprint just came out. This is looking at a huge data set in the US that includes Utah, by the way, looking at hospitalizations for COVID. It's called COVIDNet. 13 states are contributing data to this, and they're following all hospitalizations due to COVID in these 13 states, like I said, including Utah. What they found, and they've been keeping track of this since the beginning of the vaccination campaign. So you can see that first data is right after we started the vaccination campaign in the US. And these are cumulative hospitalizations. The blue line is among the unvaccinated, and the green line is among the vaccinated. And you can see a vast difference. Okay, so that is cumulative since the beginning of the pandemic, the rate. The bottom graph is week by week, so weekly rates, hospitalization rates, again, among the unvaccinated, blue, and the green vaccinated. You can see how big of a difference it is. These vaccines are extraordinary in preventing hospitalizations, and that's what matters. That's what we should be focusing on. They work extraordinarily well. I don't think we should be looking at infection. We should be looking at infection among the breakthrough infection in terms of from a public health perspective, because they can shed virus and transmit virus. But from an individual risk standpoint, really it's hospitalization we should be looking at. So that is extraordinary. And it is age specific. A is, that first graph, A is in the 18 to 49. B is 50 to 64. And C is among senior populations, greater than 65. So you can see the gap is, again, spans all ages. Okay, you can see in the green, the rates per 100,000 among vaccinated is negligible compared to the rates among the unvaccinated. More evidence that the vaccines are working really, really well. Now, this one was an interesting study. This one is published in JAMA, and this again reinforces my contention that we are vastly underestimating the number of infections in the US, mainly due to limitations in testing. I think a lot more of us have infection, both breakthrough and non-breakthrough infections than we realize. And we may be approaching, again, I should mention, I think I put in a post on Facebook about, and some folks accuse me of being very cynical. I don't think it's cynical. I think it's being realistic, which to some people is the same thing, I guess. How do we get out of this? All pandemics end. How does this one end? Well, it's gonna be a slow process. It ends when everyone has some degree of immunity to, or most folks, not a large percentage of the folks in a population has some immunity to the circulating virus, the SARS-CoV-2. That can be through infection, and that can be through vaccination. We would prefer vaccination because it prevents death and hospitalization. But right now, a lot of folks are getting natural infection, and people are going to get a combination of both. People who are vaccinated will get infection, mostly mild, mostly asymptomatic, and it's going to give them an immune boost. But I think there's going to be a lot of, I think, bottom line, most of us are going to be exposed to COVID in the next few years. That sounds scary, but what's going to happen is, especially among the vaccinated, this is going to be a disease that is very mild, like a mild flu or a cold. And yes, do people die of flus and cold? Yes. So people die of breakthrough COVID infections, but much, much fewer people, but at much, much lower rates than among the unvaccinated. but most of us will be exposed. I would not be surprised if I was exposed and I had an infection and I just didn't notice. That would be a really, really interesting study to look at seroprevalence for breakthrough infections. And by the way, there is a way to do this with antibody tests, because an antibody that specifically targets a protein that the vaccine doesn't target, we could actually differentiate the difference between natural immunity versus vaccine-induced immunity. By the way, this study did that. So this was a massive study that was continuous, and it was testing our blood supply, so blood donors. Now, big, huge caveat to this: blood donors are different than everybody else. Probably much more cognizant of COVID, probably more likely to be vaccinated, probably to take COVID more seriously, more aware of, I don't see too many anti-vaxxers going to donate blood. I could be wrong, but I think that's a huge caveat. So there might be some external validity issues with the study, but it is still really interesting. So they tested the blood supply, a sample of it, looking for infection and vaccine-induced seroprevalence. So they can differentiate that. They can test for different antibodies that can differentiate natural infection to vaccine-induced immunity. What they found was, and this was pretty random, representing all 50 cents, they found some really interesting variations by age, time, race, ethnicity, and geographic region. So that's infection. So the bottom line down here is infection-induced seroprevalence. And that's at about 20%. That means about 20% of their sample, which is supposed to represent the US population, has evidence of exposure to SARS-CoV-2. Quite honestly, that was a lot higher than I thought, 20%. But look at the combined seroprevalence. So that's combined both natural infection and vaccine-induced. And that's above 80%. So are we reaching that point where we have, our population level of immunity is pretty high, so that maybe if we are seeing this surge starting to slow down, is the virus simply running out of COVID naive hosts? This may indicate we are. Again, I think this is probably an overestimate, because I think this population, you think about the population that goes and gives blood, I think that population is more likely to be vaccinated, more likely to take COVID seriously. So I think this is probably an underestimate or overestimate. The number is probably lower, particularly vaccine-induced. But still, it's an interesting, because that's the part I don't know, and a lot of us don't know. We know that as a percentage of folks in the population, who are exposed to SARS-CoV-2 increases, well, that's going to get us to a point where we can have this very uneasy detente with COVID, where we just live with COVID. It's endemic. It just becomes like the flu or cold. That's the only way we're going to get there. Are we closer to that point than we thought? This indicates we may be getting closer than we think. I don't know. Now, this is all assuming that some other variant doesn't pop up, like Mu, which is a new variant of interest. But yeah, also there's some regional differences. You can see regional differences. This is infection induced. So you can see areas with high levels of infection have higher levels of seroprevalence. So this red is 36 to 48. So South Dakota, and remember, South Dakota, boy, they got hammered with COVID last year. They're getting hammered again. But you can see that, well, there are areas of South Dakota where almost half the population have evidence of some, basically infection-induced immunity. Now, combined with vaccine-induced immunity, you can see areas, there are areas in excess of 90% of the population show some level of immunity. Wow. That's really, yeah. Yeah. Finally, is break it down by other demographics. So the first one is area, region. So regionally, looks like not much of a difference. The B is race and ethnicity. What's interesting is the dashed line at the bottom, that's infection-induced seroprevalence. That's the highest among Hispanic. So among Hispanics, it's about 30%. And that makes sense given how hard this has hit the Hispanic Latinx population. We're more likely to be for, essential workers. So 30% of that population has some evidence of natural infection, which is about 10% higher than non-Hispanic Asian, and about 10% higher than non-Hispanic Asian, and 10% higher than white, with African Americans kind of in between. What's interesting, though, of course, non-Hispanic, if you combine it, non-Hispanic whites are more likely to have evidence of any immunity. And that's because of the higher rates of vaccination among whites. So that's interesting in and of itself. By sex, not much of a difference there. And then by age, you can see that over 6. So if you look at infection-induced, over 65 is the lowest, actually, which makes sense because over 65 were the first ones to get immunized, right? But if you look at the combined seroprevalence, over 65 has the highest, again, because of the high levels of vaccination among that population. This is fascinating, and this is kind of hopeful signs. Are we reaching that level where we have that level of community immunity? That rhymes. Community immunity. I still need to make a Schoolhouse Rock song called Community Immunity. If anybody has talent, that can animate like Schoolhouse Rock. If you even know what Schoolhouse Rock is, I know some of you are probably too young to, but I grew up in it. I need to make that. Anyways, so are we reaching that level of community immunity to get to this point where we can just coexist with that SARS-CoV-2? By the way, I mentioned this coexist, and y'all probably thinking, well, are we gonna be able to eradicate it? Flat out bottom line, no, we're not going to eradicate COVID. Not in my lifetime, probably. We've only eradicated one disease in our lifetime. That was smallpox. And smallpox has very different characteristics that allowed us to eradicate it. And even then, it was really, really freaking hard to do. COVID's not going to be eradicated. We're just going to have to learn how to live with it. Is that depressing? No, I don't think any of us in public health thought we would ever eradicate it. I mean, we all hope that, the best case scenario is it turns into a cold. And we learn to basically coexist with it at a reasonable level. It becomes endemic within the population, co-evolves with us. And that's what diseases do throughout history. They co-evolve with us. Okay. Now, boosters. Yeah, I'll talk a little bit longer if people need to hop off, that's fine. But I'll talk a little bit longer about boosters because that's been a big thing. And honestly, the wider epidemiology and public health community are pretty much against boosters. Now, Israel is implementing boosters to their wider population. And we have actually authorized boosters for those who are immunocompromised. Now that makes sense. Study have shown that people who are immunocompromised, the vaccines are safe within those populations. However, there isn't enough of an immune response, which makes sense because their immune systems are weakened through disease or medication and so on. So that third booster would probably help those folks. Maybe even a fourth booster. However, for the general population, does a booster make sense? The data is really unclear. I see no evidence that vaccine strength is waning to a degree that we need a booster. So scientifically, it makes no sense. Scientifically, it makes a lot more sense to get people with no immunity up to a baseline immunity than giving people with immunity a little bit of extra immunity. If we're going to stop this, and get that level of community immunity, it's much better to use these doses on people who don't have any immunity. Now, easier said than done, because those folks have basically said they refuse to get it, or we can't get those vaccines to the countries that really need it. Okay, there's a practical aspect. There's a moral aspect as well. There are folks in Africa who have no doses. Frontline workers working with COVID every day, not one dose. And we're going to give people a third dose to people who already have a high level of protection. So the moral argument just breaks down. I totally agree with the WHO on that. The WHO has been adamant, very vocal about how immoral this is, how unethical this is. And I agree with them. But on a practical level, how do we get the vaccines right now to those countries? So there's a lot of issues. Bottom line, though, I don't think boosters make sense. Now, a couple of Israeli studies came out that the Israelis are saying, no, 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 we need vaccines. We need that third dose. I'm going to stray out of my lane here. But this smacks a little bit of desperation and politics getting in the way. Israel had a change in government. The Prime Minister, Netanyahu, was removed, voted with confidence. New Prime Minister came in. They don't like each other. The new government is very much against shutdowns. They've opened up the economy. They're seeing a spike higher than ever, breaking records. Netanyahu is still in the background, criticizing the government for their response. They're desperate. I see a little smack of that. The data itself is not compelling to me. Maybe to some folks, and I know Dr. Fauci, and I'm disagreeing with Dr. Fauci here because he actually said these studies show we need a third dose. I disagree with him. So the first study here is a study that showed, oh, hey, we're going to do a third dose. They did a study. Israel has a massive healthcare systems. They have all sorts of amazing data. Swear to God, epi is way easier in the UK and Israel because they have access to such great data, because they have nationalized healthcare systems. Epi is so much harder in the US because their healthcare system is so fragmented and just, quite frankly, has a really shitty data system. So which makes American epidemiologists way better because we have less, anyways. I think so. Don't tell that to my UK colleagues. So anyways, they have these massive data sets. So they're comparing, so they actually did implement that third dose, and they were comparing those with 3 doses and those with 2 doses. So they did what's called a case control study. They took a bunch of folks who were diagnosed positive and determined whether they have 3 doses or 2 doses. They found that, oops, let me go back here. They found, yeah, for infection, now this is infection, not hospitalization, short-term infection, it seemed that that third dose decreased the risk of infection, not hospitalization, just asymptomatic infection, which tells me not much. This was very short term, and they was only looking at infections. If I'm going to look at a third booster, I really want to see if differences in hospitalizations and death. Nothing there. So this is really preliminary. We still may see that. I don't know. But right now, I see no data to support that booster. They also say, well, hey, look, we're showing in this study that those folks who were vaccinated in December, remember, Israel started the vaccination campaign last December, and they compared them to people who were vaccinated later. The idea being, hey, those vaccinated in December, it's been like 8 months. Those vaccinated in April, it's only been 4 months. So if immunity is waning, those folks who were vaccinated in December, we should see evidence that their breakthrough infections are increasing. So they did that. So you can see the vaccination period. So the darker colors are between January and in January, and then first part of February, last part of February, and so on and so forth. And you can see, oh, look at the rates among those who were vaccinated in January compared to rates that were of those vaccinated in April. They're higher. Okay, that makes sense. The problem with that is the people who were vaccinated in December are very, very, very different than the people who were vaccinated in May. They had the same schedule as we did. They vaccinated the sickest and the most at risk first, along with healthcare workers, and then the less risky. So yeah, of course, breakthrough infections, hospitalizations, and deaths are going to be higher in those who were vaccinated in December because they were originally at the highest risk. They were different than those who were vaccinated later. Anyways, not compelling data. We have no idea if. I mean, the evidence that vaccines are waning is really, to me, very iffy. I just don't see a need for a booster. So anyways, I mentioned last week I was going to go over this week, and I'm going to mention that I'm going to go over this next week. These are more surveys that were done on vaccine hesitance. I do want to go over this because these are fascinating. This one in particular, it's about vaccine uncertainty. There's one about attitudes towards the unvaccinated among the vaccinated, and also attitudes about vaccination among healthcare workers. I do want to go over those, but I'm now pushing 2 hours, and I actually have to teach stats later on this afternoon. So I will have to log off this week. But if you have any questions, please pop me an email, pop me a text. I'm more than happy to answer those. If you have suggestions, by the way, of future topics, I can also cover that as well. I think there's still a lot of folks who are just yearning for information. I had my seminar, I was going to talk about careers in public health. I ended up talking about COVID because there were so many questions. So please pop those over to me, and I can kind of create more brown bags that are more theme-based. So, but yeah, otherwise, have a good holiday weekend. Please stay safe because COVID is circulating. Wear masks as much as you can. You know, try to stay away from large gatherings, but otherwise stay safe, and I will be back next week. So thanks for attending, and see you later.